Today on the PIO podcast, I'd like to introduce Brian Townsend, a retired DE agent from Only 2 MG and non-for-profit. Brian, welcome to the show.
Thank you. I look forward to the discussion. Thank you.
Brian, you have spent an extensive amount of time, over 3 decades, nearly 3 decades in law enforcement with the DEA. And we'll talk about a little bit more about the DEA later, but including leadership roles and doing training. What first opened your eyes to how serious a fentanyl crisis was, where it would go?
Yeah, after 30 years in law enforcement, I never saw a drug more impactful than fentanyl. I mean, we've seen some pretty dangerous drugs, and all drugs are dangerous from that perspective. Never saw a drug change the landscape. Experimentation, casual drug use, and never saw a drug do what fentanyl has done. And it's not even the most dangerous drug out there. I mean, unfortunately, these traffickers continue to make, worse drugs, but this is a drug that once it came into our drug supply, just took over, and the number of people who died, who were poisoned by this, increased. I mean, we had a horizontal line, and I'm not minimizing those lives. That's too many. And then it just literally turns vertical. And when you dive into that and you figure out why it turned vertical and why it continued to go up, it's fentanyl. I mean, 2 years ago, we lost 105,000 Americans to one drug. Last year, or 2024, I guess we're already in the new year, but we lost 82,000, and everyone's excited about this decrease. And yeah, it's great. 80 is great, but it's still 82,000 Americans who lost their lives to drugs, and one's too many. We don't know what the 2025 numbers will be yet. Hopefully they continue to decrease, and our work's not done until it's zero.
Yeah, that's crazy. I was just thinking about those numbers, and I'm going back to, I remember something from a history class about the Confederate War, and thinking, I remember 155,000 was a number both north and south, kind of like the most deaths that happened in a short time war in our history. And then you hear this, and yeah, nobody really thinks about it because it's drug addicts. It doesn't matter, but 100,000 people, that's some big towns.
Yeah, one of the things I always show is that the government's been collecting, they call it overdose deaths, but the government does. I call them drug poisonings. And we've been collecting this data since 1968 in this country. And one of the slides I show, in fact, I showed it a couple different ways, and I talk about how it's probably the most dramatic slide I can show in my main presentation when I talk about fentanyl, is this slide. And I say from 1968 to the year 2000, we lost 225,000-ish people, a lot of people, over a 32-year span. In the last 3 years alone, we've lost more than that. So in the last 3 years, we've lost more people than we did the first 30 plus years of tracking this data. And again, I mean, we're literally talking about a horizontal line that turns vertical. And we've never seen anything like that before. And we really got a grip on this. I mean, I think we're in crisis mode. People don't see it that way because, like you said, they look at it as, they're just drug users, just, addicts, junkies, the different derogatory terms we hear. These are people, they're not just numbers, and their sons, their daughters, their family members, their loved ones, neighbors, community members. These people matter.
Right. Brian, you do presentations and stuff as part of your work that you do with your nonprofit. In your research, is there anything that you could say how all of a sudden fentanyl became that drug? I know China has some influence on it with precursors and stuff like that, but how did all of a sudden it just went boom?
Yeah, and that's something I do in my main training program, which is 4 hours long. It's called the illicit fentanyl crisis. And I talk about that, the historical context, how fentanyl got into our drug supply. So let me give you the Reader's Digest version. So prior to 1996, pain management in this country was really pretty subjective. If you went to a doctor and you said you were in pain, for the most part, and I know there's some outliers and things change, but for the most part, that doctor's probably looking for a bone sticking out of your body. Again, I know people can game the system. I know there's some outliers, but for the most part, pain management, wasn't here you go. Here's 30, 60, 90 days worth of opioids. In 1996, we changed that. We added pain as a fifth vital sign. And then the same year, in fact, if you dive deep into that, it was the pharmaceutical industry, predominantly Purdue, that really lobbied for that for decades in the medical community. And in 1996, we changed it. We added it as a fifth vital sign. And then they also released OxyContin the same year. And they weren't the only company involved. There were a lot of companies. So now you go to a doctor and you say, I'm in pain. Here you go. We were told they were non-addictive. So you went home, you have a wisdom teeth taken out. You probably went home with 30, 60, 90 hydrocodone pills, no questions asked. And it just got out of control. And then when doctors realized that, oh my goodness, this is crazy, and we need to, wean you off or cut you off, what'd you do? You went to another doctor, right? That's why we have the systems that we have in place now, where if you go to a doctor, whether you know it or not, he or she is actually putting your name into a system, making sure you're not doctor shopping. You know, the pain management clinics, we call them the pill
Hmm.
mills. Those popped up. I mean, it just got out of control. And we know that heroin. So let me jump to heroin for a minute. Heroin is also an opioid, okay, but it's much much more addictive and stronger. In fact, until fentanyl came around, it was the most powerful opioid on the market. 80% or more of heroin users start with legal opioid prescriptions. Let me repeat that. 80 or more percent of heroin users start with legal opioid prescriptions. So now let's go back to 1996 to, let's say, 2005, 2010, that time period. We flooded the market. I mean, we absolutely flooded the market. So naturally, a lot of these people started to turn to heroin because they needed a stronger opioid. And the traffickers, they couldn't make this stuff. The manufacturers, they couldn't make this stuff fast enough at heroin. So they needed to cut it more and more. And fentanyl was the perfect cut. Both opioids. It's cheap, it's powerful, and it's highly addictive. So they started to put fentanyl into our heroin supply. And then that's two things happened. The deaths just skyrocketed. And again, that horizontal line that turns vertical. And then it started to ease its way into other drugs and just take over. And like I said, after 30 years of law enforcement, I've never seen a drug more impactful.
Okay, you just explained why it got there. Now, for those people that may not understand what fentanyl is and what it is, can you explain in clear terms what fentanyl is and how deadly it can be?
Yeah, so fentanyl is an opioid. Let me clarify real quick. Legal fentanyl is not a bad thing. We're talking about illicit fentanyl. We're not talking about if you've been hospitalized, surgery, severe pain, you probably had fentanyl or an analog. Not complaining about that. We're talking
Right,
about
right,
illicit fentanyl.
right, right.
You know, uh, so there is a distinction there. So fentanyl is an opioid, and what it does is it works on the receptors, the mu receptors, and it attaches itself to the receptor and it either reduces or stops the intensity of pain. So the way I always like to describe that is imagine remember when we were kids, we would play things like King of the Hill. You're up there and you're making sure your buddies don't get up on the hill. Well, that hill is a receptor. And if you're the king of the hill, you're the opioid. And everyone else who's trying to get up on that hill, that receptor, their pain. And your job is to keep them off. And again, if you've ever had, medical speaking, if you ever had, morphine, opium, fentanyl, anything like that, you know how fast it works. And it's very, very effective. So the problem is it overwhelms the system. We're not talking medical setting now. We're talking about street use, right? And it overwhelms the system and it just takes over. So your brain tells your heart, hey, I got this. We don't need you anymore. So your heart starts to beat less and less and less. That's called respiratory depression. And that's what kills people. We call it the sleepy death.
Yeah. Okay. What quantity in fentanyl? I've heard this, the size of a pencil head. I've heard that before, and I'm assuming that's why you use two mg for your not for profit. So 2 milligrams.
Yes, sir. 2 milligrams. Yeah, absolutely. That's why we named the nonprofit that 2 mg, 2 milligrams. So you're right. I mean, you're talking about the tip of a pencil head. Another example I like to use is sugar packets. A sugar packet like a sweet and low is typically 1 gram. So 1 gram is 1,000 milligrams. If only 2 milligrams is a deadly dose. Now let's just say that sugar packet is now fentanyl. Little sugar packet. We can all visualize that. And it has 1 gram of fentanyl in there. That's 1,000 milligrams. If 2 milligrams is a deadly dose, that means that one sugar packet could have 500 deadly doses in it. So often, especially when I talk to young people, I'll take that sugar package and I'll put it into a little glass vial and I'll pass it around because if I'm talking to a student body, and let's say there's 300-400 kids in the room, this little tiny vial can kill literally their entire student body. I want them to physically see how small it takes to end a life. I mean, only 2 milligrams.
Right. Right. So you mentioned this earlier that fentanyl started getting mixed in with other drugs and heroin. How real is that threat in regards to the drug community now? Because I know because the illicit pill mill market is so big with fentanyl, it's a little different.
Yeah, I mean, once it came into our drug supply, it just took over heroin. I mean, heroin's still out there, but you can look at the seizures and you can, especially on the border and stuff like that. I mean, just record low numbers amount of heroin coming into the United States now. And if you do find it, there's about a 75% chance it's going to have fentanyl. So once it came in, like I said, as a cut for heroin, it took over. It just took over heroin. Then it got into our pills. And now it's in cocaine and methamphetamine. One of the statistics or one of the programs that I track is the National Forensic Laboratory Information System, NFLIS dash drug. And it's a program that DEA runs, and they work with about probably 98, 99% of all the drug labs in the United States. So I don't care if it's fed, state, local, if you have a agency submitting drugs, more than likely at 98, 99% chance it participates in this program. So what I look at is I look at drug submissions, and what's being submitted and what it contains, and it's mind-boggling. And to give you some perspective here, in 2014, law enforcement seized about 5,500 instances of fentanyl in the United States. A lot, but really didn't put it on the top three list. I mean, methamphetamine's always been number one, cocaine number two. By 2019, it was over 100,000. By 2020, it was over 200,000. That's a 3,500% increase in 5.5, 6 years. Amphetamine is still the most seized drug in the United States, but number two, now fentanyl. It barely scratched the surface. I mean, it was a problem in 2014, but as far as how much we were seeing, really kind of barely scratched the surface. And now it's the second most seized drug. And when you dive deeper into those drugs, I mean, we're seeing an increase in methamphetamine. The last I saw was about 17% of meth now had fentanyl, about 25-ish% of cocaine, almost a quarter of all the cocaine submissions now contains fentanyl.
I want to talk about that because I just saw there was just a massive seizure in Indiana at a traffic stop where they took, I can't even remember the amount, but it was a massive amount. So you're saying that a good chunk of cocaine that's coming into the country now has been laced with fentanyl?
Yeah, or it'll get laced when it gets here. So we're seeing both. I mean,
Okay,
yeah,
okay,
we're seeing it both from
okay,
Mexico and in the United States because it's
okay.
a cheap drug. It's powerful.
I know my son is in a Coast Guard anti-drug unit, and they seize boatloads of this stuff, all the time. And he's like, "Yeah, yeah, Dad, our whole boat took 60 some pounds of stuff." I'm like, it's the back of a big ship. They've
Yeah,
got it all loaded on pallets, and I'm thinking, man, if that's all just cocaine, yeah, but if it's cocaine potentially mixed with other things, that's even worse.
yeah. Depending on where it came from, especially like South America and stuff like that's going to be all cocaine.
Yeah,
But we
yeah.
do know some
Okay,
cartels will mix it. But yeah,
okay. So exposure risks. I know there's always this talk about this, and I know that this is a cop thing. Cops are always freaking out about this, and that all of a sudden they open up something and powder flies out. What are the odds that they're gonna get exposed and they're gonna get incapacitated by that?
you could win the Powerball lottery 2 or 3 times before that happens. So all the videos, all the media you've seen around it, false. None of them have been proven true. Now, the little asterisk I'll put next to that is always take precautions, use common sense. I always wear nitrile gloves. There's a company called Public Health and Safety. I love their gloves. In the event that, let's say, my glove gets compromised or some reason I'm touching it barehanded or powder gets pushed in the air, I'm going to be okay. Again, I literally could win the Powerball 2 or 3 times in a row before I overdosed. So, and if you, and I'm not making fun of the law enforcement community. I came from that, 30 years of that.
Yeah.
I mean, you're talking about a drug that has found its way in everywhere. So why aren't users outside of actually consuming the drug falling? Why aren't traffickers falling? I have videos of cooks down in Mexico making this stuff. No PPE, nothing, no gloves, nothing. I mean, common sense defies this. It's only this one sector of population. Most of the cops, it's interesting. I've trained thousands of cops, especially the last couple of years on this stuff. Most of them know this. It seems like it's always a lot of uh, command staff level. Nothing against them. I'm making fun of chiefs or sheriffs, but I think
It's okay, you can.
I think the reason is because when they were line officers or line deputies, The belief, especially around 2016, 2017 time period, was that this was dangerous. I used to believe that. And then as you work it and as you learn more and you look at some of the stuff behind it, you realize, no, we're around this stuff all the time and we're okay. But those folks have never been properly educated past the incorrect information. And now they're stakeholders in their departments, right? So
Right.
now you can't do presumptive drug tests. You can't, we're going to retire our canines and all drugs get sent to the lab and wear 16 pairs of gloves and 8 masks and level A and blah, blah, blah. I mean, some departments have really shifted the pendulum quite a bit and just, you don't need to. You really don't. And it's funny I can't tell you how many officers I've had from departments, how many narcotics, some large, large, large departments in the United States who are like, can you please talk to our colonel or our director or our chief. And I'm like, it's your agency. I'm not telling you how to run it. I'm just telling you that you're going to be okay to be around this stuff.
Right. Brian, how can local public information officers or first responders and schools work together to come up with consistent messaging that doesn't like do the scared straight thing, but actually motivates safer choices? How can they do that?
Well, first of all, make those phone calls, establish those relationships. It saddens me when law enforcement just, oh, I don't even know who the principal is or who the school board people are. Make those relationships. Pick up the phone, get in your car, drive over there, have lunch, give them a challenge coin or a coffee mug, something, and start developing those relationships for many, many reasons. But one reason is then get into the schools, start having these conversations. I don't care if it's a classroom, I don't care if it's an auditorium with the entire student body. Just make these relationships and get the information out there. I mean, these kids are starving for information. And unfortunately, I mean, I'm not telling people how to parent, but there's a lot of parents who I've literally had parents say out of sight, out of mind. We don't talk about drugs because if we talk about them, then all of a sudden they're going to use them. And I'm thinking, are you kidding me? I mean, have you been on social media? Have you watched a movie? Have you listened to
Right.
music? The goofy drug
Yeah.
traffickers or goofy friends, the drug traffickers. I mean, they're going to get information. So let's get
Yeah.
ahead of it and give them
Absolutely.
actual information.
Hey, in your view, Brian, what role should community storytelling and real life experiences play in fentanyl awareness campaigns?
I think it's important for sure, but I think it has to be accompanied by information. Like I work with a lot of families who have lost sons or daughters, and I think it's wonderful that they're getting into schools and community organizations and providing the message. But it's often, and I'm not criticizing, I'm really not, but it's often a message of my son or daughter died, a lot of tears, a lot of emotional and scaring type tactic. And we know that that doesn't always work with kids. Like the just say no thing with Nancy Reagan.
Right. Never worked. Scared straight never worked.
Absolutely. And yes, it's sad that your son or daughter died. I tell you, I work with a lot of folks in that situation. And I love when they tell their story, and sometimes I'll tell it for them, but it's got to be accompanied with other information. Why did their son or daughter die? You know, the half a pill they took had more than 2 milligrams of fentanyl, and it only takes 2 milligrams to kill you. And this is what it does. This is how it kills you. When you arm people, especially young people, because they're not dumb, with factual information, it makes them more confident in situations. Now, I'm not naive to think they're going to walk away from drugs, but we know statistically speaking that the more information you give them, the more likely they are to not try drugs. And if we can keep them to age 18 not using drugs, their chances of never using drugs ever in their
Are
life
really high. Yeah.
are really high.
Massively high. I know when I was doing the prevention thing, that was one of the things that we always talked about. You just look at smoking. If you're not smoking by the age of 18, you're probably not going to smoke ever. And
Absolutely.
it's the same thing. So yeah,
100%.
absolutely. Brian, you said reducing demand is key part of the solution. What community-based strategies have you seen would you recommend that successfully reduce demand?
Well, outside of the prevention and awareness, we need a public campaign against the stigma. We talked about it early on this call where, they're a junkie, they're an addict, who cares? It's a moral failing. They made their own bed, let them sleep in it. I mean, I hear all this stuff all the time. We've got to reduce that cruel perspective, that stigma. I mean, think about it. If you have a son or daughter struggling, rewind. If you have a son or daughter with, let's say, cancer, My goodness, everyone's going to be making you dinner every night. You're in my thoughts and you're in my prayers, blah, and that's good. That's great. That's a community and family standing up for each other. Same son or daughter has a problem with, let's say, drugs or alcohol. I mean, they can't get away from you fast enough.
Mhm.
They don't take your calls. I mean, it's complete difference, and I think that's a disservice to community. That's a disservice to what friends and family should be doing. It doesn't mean you say, "Oh, great, your son's using drugs," or blah blah. It doesn't mean you approve of this type of behavior, and it doesn't mean there shouldn't be consequences for this type of behavior. But having a little empathy, let me tell you, when I started to have, it's one thing to say you have empathy, but when you start to actually show that, people who struggle with this, man, they really open up to you, and that increases your trust and that increases your communication. And you can be a lot more effective when two people look at each other with that shared goal and that shared value, of this person really does want to help me. And I think he's sincere about it. That's what we need to do. We need to, if we want to reduce demand, we gotta, because I mean, let's face it, there are a lot of people out there who are struggling with drugs, alcohol, who will not seek help because of the shame and the embarrassment. And that's a disservice to them.
Yeah, no, I agree 100% with you. I've seen it. I've seen it actually. Brian, I just want to go off on a tangent here. Let's talk about, just the other day, we had a narco terrorist arrested and brought to this country from Venezuela, Maduro, President Maduro, or dictator Maduro. What are your thoughts on it? And will it have an impact eventually? I'm sure it's not going to have an impact right now, but it's going to have an impact maybe.
Yeah, I'm actually happy. We removed a narco terrorist from, destroying his country and the beautiful people of Venezuela. And that's why they're so happy right now. And unfortunately, we live in such a polarizing political time where people can't look at it that way. In fact, I was just having this conversation and made no reference to Trump or politics. And it's like all of a sudden there's something wrong with me because I was, happy and rejoicing that this horrible human being is no longer in power and he's going to have to stand for the horrific crimes that he's done. So yeah, I mean, I'm excited. It's pretty cool too when you start looking into when they start releasing more information on how they actually did this
Yeah.
remarkable op with all the planes and helicopters and people. But proud of DEA, that years and years of work putting this case together, or cases plural together, against him and his co-conspirators. And people don't realize how much of a criminal, how much of a thug this guy was, and how
Mhm.
embedded he was with crime. Hezbollah, Iran, not just China and Russia, things you hear about, but this was a bad guy. And truly, I don't care who's in the White House. This is a guy that needed to be removed. We try to do it with incentives, with money. We tried to, if you look at the, especially the prior administration, we wanted a fair election. Unfortunately, we didn't get that. Of course, that's what we in the United States wants because we know that's good for the Western Hemisphere, right? And it took this, and you don't have to like Trump to agree with this. Let's just put that.
Well, you could put a $50 million bounty on somebody, but if he's never going to leave the country, how are you going to take him? Who's going to pick him up? The only way they were getting him was go to there and get him by force.
Yeah. Yeah, I mean, look, Noriega, we did the same thing back in '89 with Bush. I mean, and I know there's some differences with even Bin Laden. I mean, everybody complains, oh, they're a sovereign country. I mean, we went into Pakistan and picked him up, and no one complained. And I didn't need to know it. Congress didn't need to be briefed on that, and that was during the Obama administration. Again, doesn't matter who's in the White House. Some things need to be done, and listen, we yield a lot of power in the world, right? The United States does, and whether you agree with it or not, or whether you like some of the decision or stakeholders, the reality of it is America is better off without Maduro in office.
All right, Brian, let's bring this back into the fold here. What do you think are most important things the public should know about the role of organized crime
Ooh,
supplying supply chains in the fentanyl crisis?
yeah, China. I mean, oh my goodness, they are all over this equation. If you look at the supply chain, I mean, the majority of chemicals we call them precursors to make fentanyl come from China. So India's up there as well, but China is by far number one. So they physically send the precursor chemicals, typically by cargo ship, right into Mexico. The cartels get that. Same thing with methamphetamine. I mean, that's where they wrote the playbook. They would import the chemicals, mass produce methamphetamine, and smuggle it into the United States. And now they do the same thing with the fentanyl. They chemicals come from China right into Mexico. Stuff is mass produced, and they're very good, unfortunately, at smuggling drugs into the United States. And that's what they do. And the result is that we are flooded with these poisons. And you look at the number of people dying in the United States; it's overwhelming.
So, and again, going international here, does that mean that basically China's they're doing an underground war by sending in the precursors to create this deadly drug? I mean, they killed. If you look at it that way, they killed 300 or 400,000 people in the last 20 years.
Not only that, but they killed a lot of military age men in the last 3 or 4
Yeah,
years. If you want to break it
yeah.
down even, I mean, and obviously older, younger, female, blah, blah, blah. But if you look at, the common warfighter, that 18 to 23-year-old male, that's a demographic that's been hit hard with drugs. I mean, this perfect way to destroy our country without sending a soldier. So I mean, yeah, I mean this is classic China, and it's disturbing, and more needs to be done for sure on that front.
All right, got it. I like it. I agree with you 100% on that. All right, so for first responders and stuff, I jumped over a question here. From your experience, where do you see the balance between law enforcement action and public health outreach tackling the crisis?
Almost like I was saying earlier, we got to break down those barriers. I can't tell you how many times, even when I was at DEA, where I would call people who were in that treatment recovery sector, and it was like, "You're with who? DEA? Click."
Mm,
And I still get a little bit of that where, oh, you were in law enforcement. You don't have lived experience. You just put people in jail. And it's, get to know me, get to know my heart, get to know, it's one thing I can say as much as I want, but if you get to know me and see that I'm actually authentic and I actually care about people, well, that's when we start to again develop trust and relationships and start to work together, because we can't arrest ourselves out of this. I used to believe that at one point, but we can't. We can't build jack. We don't have enough people, money, jails, blah blah blah. We've got to work together. Communities have got to come together. We got to remove the stigma. We got to give a damn about people, and we got to put all of our resources together to continue to fight this. It's a holistic approach. It's not, you know, this one sector or this one sector. We're just spinning our wheels. We're all recreating the same type of work, and it's frustrating.
Brian, what metrics or signs should communities look for to know that they're making progress in their awareness, prevention, or their treatment outcomes?
I think I mean, the obvious ones I think would be just the amount of people, being poisoned, that are, the overdoses in our community. That's for sure something that we can measure. I mean, those are pretty easy metrics. I think you get a sense of your community, and if you're doing more in it, you're working in the schools, working with the different organizations, NGOs, whoever it is. You get a feel for, is this resonating with people? Is there a demand for this information? Are the schools bringing me back every year and making sure that these kids, as they grow up, are learning this information? I think those are measurable things that we can certainly show success on.
Right, right. I'm just looking at some statistics for Cook County, which is the county that I live in Chicago. Their 2025 statistics were going down, which is good. But they had in 2022 they had a record 2,000 opioid overdose deaths. That was 91% of it involved fentanyl. That was in 2002 or 2022. And now the peak happened in after 22, and now they're down considerably now. But there's still 73% are confirmed opioid toxicity cases for males.
Yeah, I mean, I know that's Cook County, but those statistics you mentioned are very similar to really what we're seeing across the country. If you have a drug overdose, there's about a 75% chance it's going to be fentanyl related. In fact, most of the calls I get, when I get a call from a detective or law enforcement or whoever, it's like, "Hey, we just had a drug overdose, 16-year-old female, blah blah blah." I'm like, "Fentanyl? Probably a pill." Like, I mean, it's disturbing. It's not like I have a crystal ball. It's just something we see over and over and over again. Glad to see the numbers have reduced. I think a big, huge reason for that is naloxone, Narcan. You know,
Mhm.
it's easy to get now. It's being distributed more and more and more. In fact, I've even seen people who are struggling with substance use disorder, addiction, have it, on a chain or strapped to their body, right? But that doesn't work's not over at all.
No, no, because let's face it, the naloxone or Narcan, that's a short term, and sometimes it takes 3 or 4 doses to counteract the effects of fentanyl if it's a hot shot, and that's the risk you play, and then they just go back to doing whatever they're doing, and nobody goes to the hospital because that Narcan's gonna eventually wear off.
Yeah, you're absolutely right. And ultimately, I mean, even beyond that, I mean, why are they using drugs? What is there trauma? Is there some type of incident? What demons are they fighting or trying to cope with? And not that all people use drugs because of that, but we know that a significant number of people who are struggling with, quote unquote addiction are struggling with something that they need some type of root cause. So yeah, we're just prolonging like you said, the overdose until we actually dive in. That's why, again, we need that more holistic approach. The medicated assisted treatment, if you will. Not only do we need to wean them off, get them off the drug, we need to figure out why they use the drug. So it's great if I can get you off the drug, but if you're struggling with, I don't know, some past trauma and your only way of coping with it, at least in your own brain, is by using drugs or alcohol, well, then we've done nothing, right? I mean, we've
Right.
got to solve that root
Well,
cause.
look at what we've created with since COVID with all these kids from school. From I mean, I know what my kids went through in college. My 2 boys were in college at the time, and I know exactly what their friends went through. I see some of the kids in younger there are so many kids that are on ADHD meds now and antidepressants and anxiety meds, and all that kind of plays into the potential for drug addiction
Yeah,
down the line.
I, there's a trend I've been watching for the last several years, and I've raised the alarm several times. In fact, I have a lot of reporters who I've spoken to, and they're always asking me, "Anything else that you can tell me?" And I always respond with this. And sometimes, like I said, I proactively send this information, and all of them are like, "No, have no interest." And that's stimulants. If you follow stimulant use in young people, we've seen a substantial increase. Again, one of those horizontal lines that turns vertical. And now, I mean, you can't go to a college campus without, I mean, the ADHD medicines and the different stimulants out there. What do you think these people turn to when they can't get enough, quote unquote? Cocaine
Yep,
and methamphetamine,
right.
psychostimulants. It's the same, literally, and this is what pisses me off. I got to be careful here. I don't, I don't get too out of control here. If you look at history and you look at opioid crisis, and we talked about it, opioids led to heroin. Heroin led to fentanyl. Okay. Too many stimulants leads to an increase in psychostimulant use, which also has, by the way, the methamphetamine and cocaine has
Mhm.
all in it. And we're seeing more and more young people. I cannot tell you how many narcotics officers I know across the country that have told me, "Oh yeah, we're seeing a lot more meth and coke cases with young people." Now,
Mhm.
I know the pushback is, well, my kid needs this stuff. And I'm not saying some kids don't. You're a parent, you do whatever you have to do for your son or daughter. But what I'm telling you is from my perspective, when I look at the overall numbers and I see legal, medicated from a doctor's go from this to this, that's an issue. And you heard a couple years ago, like, we had a shortage of some of these medications. We didn't have a shortage. We couldn't make this stuff fast enough. So the quotas, which FDA and DEA is involved, these companies would say, "Hey, well, we can't do anything. Our hands are tied. The federal government. You got to talk to the DEA. You got to talk to the FDA." These parents would call their senators, and you can Google this stuff, and they would call DEA and then FDA and everybody else and say, "You need to increase the quotas." And that's exactly what we've literally cowered to these companies and allowed them to make more and more of this stuff, and they do it for profit. You can't tell me that 100% of these. I mean, literally, this to this, it's a
Yep,
problem, and we're already seeing
yep,
an increase in psychostimulant use. And when I say that again, I'm going to make it clear: cocaine and methamphetamine. That hasn't gone away just because there's fentanyl out there. In fact, it's increased, especially with young people. And there's a correlation there. And we should give a damn about that.
yep. I agree. It's also interesting how energy drinks tie into all of that. I mean, the amount of kids that are using energy drinks and not just 1 or 2, but cases during the day. It's crazy.
Yeah, my heart would
I
explode if I take 2 sips of one of those.
yeah. How do you see the fentanyl crisis evolving in the next 5 to 10 years? You know, in your brain, where do you see it going? Okay.
Fentanyl is so popular with drug traffickers and manufacturers and traffickers because it is a synthetic. I mean, heroin and fentanyl are very similar. I mean, obviously, fentanyl is 50 times more potent. But if you look at the production of both heroin, you have opium, right? You have the poppy plant. Has to it needs you need a seed, you need soil, you need water, you need the sun,
Right.
you need time, and then you have to go from that opium to morphine and morphine to heroin. Not a hard process, but it takes time. Fentanyl, we're literally talking about mixing chemicals together, and voila, here you go. It's cheap, it's powerful, and it's more addictive. So I see the future as more synthetics. We're already seeing that. I mean, I don't know. I always joke and kind of partially joking that there's some contest on the dark web of who can make the nastiest stuff. Because unfortunately, people are, and unfortunately, there are people willing to consume, to put these products into their mouth, their nose, their veins. And I see that continuing to, I mean, what we hearing like the ISOs, the nitazines, that's hitting the news a lot lately. Just all synthetics. That's the problem.
Right, right. What call to action would you like to leave with our audience about engaging their neighbors, school, and local leaders in the fight against fentanyl?
I'm going to reiterate what I said earlier. First of all, care. I'm probably the only person in this space, in this nonprofit space, who hasn't lost a son or daughter to fentanyl. So I get asked a lot, what's my motivation? Why does it matter to you? Because I care. I saw what this was doing for, decades of my life. And I saw how this was firsthand, how this was just destroying and continues to destroy families and communities. And I know that my background with DEA and my background with things I've done will get people in the seats. And if I can get them in the seats and I can give them information, if it's kids, great. If it's adults, I can make them force multipliers. I can give them information. They can go back into their own homes, their own families, their own circles of influence and provide information that might save a life. And that's important to me. So just caring and you don't have to go out there and start a nonprofit. You don't have to give a presentation, but just not looking at when you have a friend or a neighbor whose son or daughter or family member is struggling with this, not turning off your lights and acting like you don't know these people anymore. Actually just putting a hand out there and saying, "Hey, this must be hard. What can I do for you?"
Right,
I mean, just
right, right.
being a good human being.
I like that. Is there a question I should have asked? And if so, how would you have answered it?
I thought the questions were great. I really did. No, I mean, I really do believe we're in crisis mode, especially our young people. They need this information. They need help.
Yep, yep, I agree. Brian, I was going to do these rapid fire questions, but I don't think it's appropriate for the message we're saying that we're talking about, and that's okay. Because I'd like to go with some final thoughts. What key points would you like our listeners to take from today's interview?
But only 2 milligrams is enough to kill you. When you talk to a family member whose 20-year-old family member and two of her girlfriends took an Adderall pill and split it into 3 pieces, and one child didn't wake up from that third of a piece of a tiny pill, you have to understand how dangerous this drug is and how
Hmm.
it kills. It doesn't matter how much money you make, what sex you are, what race you are. It's indiscriminate. It kills everything in its way. A couple of years ago, like I said, 105,000 Americans lost their life to one drug. Well, not one drug, to drugs. And if you dive into those numbers, it's 75%. So that's 80,000 people. Last
It's
year,
mind boggling.
it is, and again, the numbers have come down, but it's still 75% because of one drug. And I said this a couple times, and I guess I could leave it with this. In 30 years in law enforcement, I've never seen a drug more impactful. I've never seen a drug have the profound impact and effect that fentanyl has had in this country.
Thank you. As we wrap this up, is there a piece of wisdom or a motto that you live by?
Just what positive change can you make in this world?
That's good. How could people best reach you if they want to connect or follow up or learn more about your nonprofit?
Our website is at only2mg.com. So it's ONLY, just the number, it's not spelled out, and then MG, which stands for milligrams.com. So www.only2mg.com. It's only a little bit of information, and we've just had it finally updated. The 3 different presentations that we offer are in there. Contact information is in there. We're having a big drug conference this year in the Kansas City metro area. It's in Overland Park, Kansas. May 19th and May 20th. It's going to be, I mean, it's open. There's going to be a lot of law enforcement, treatment, recovery, educators, healthcare, I mean, families. It'll be open to everyone. There
Wow.
is a slight cost to that, but it costs money to rent venues and bring food in and things like that.
Absolutely.
You know,
Absolutely.
unfortunately, I have to pass that on a little bit, but $125 for 2 days of, I mean, I think there's 12 speakers, all national speakers, phenomenal.
That's cheap. That's cheap.
It is. We did it last year in
That's cheap.
Springfield and it went really well. So we're going to do it again this year, hopefully double the size of participants and have more of an impact.
Outstanding. Brian, this has been a real pleasure. I really appreciate your time today. Thank you very much.
Hey, thank you. I appreciate the opportunity. Thank you very much.